Acids-base imbalance. Arterial blood gas (ABG) collection.
Draw from radial, brachial, or femoral artery. Be sure disinfectant has dried. Neonatal collection via umbilical catheter. Heparinized, airtight syringe needed. Pack specimen in ice. Notify lab if supplemental oxygen is used. Apply pressure for 5 minutes after blood is drawn. Capillary blood analysis sites, ear for adults and children, heel for infants, warm site for 5 minutes.
Normal for ABG's pH, 7.35 to 7.45 PCO2, 35 to 45 millimeters of mercury. Remember this by taking the 7 away from the pH. HCO3, 24 to 39 milliequivalent per liter. PCO2, 80 to 100 millimeters of mercury. To determine imbalance, draw arrows in the directions of the value. First, start with the pH. Of it is greater than 7. 45, draw the arrow up, alkalosis. If less than 735, draw down, acidosis. If normal, mark as N. Then, check the PCO2. If it is greater than 45 millimeters of mercury, draw the arrow up. If less than 35 millimeters of mercury, the arrow down. If it is normal, mark with an N, then do the same for the HCO3. In respiratory acidosis, pH is decreased, PCO2 increased, and HCO3 is normal. In respiratory alkalosis, pH is increased, partial pressure of carbon dioxide decreased, and bicarbonate is normal. In metabolic acidosis, pH is decreased, PCO2 is normal, and HCO3 is also decreased. In metabolic alkalosis, pH is increased, bicarbonate is also increased, and partial pressure of carbon dioxide is normal. If the pH and PCO2 arrows are in opposite directions, the disorder is respiratory in origin. If the pH and HCO3 are pointing in the same direction, the disorder is metabolic. In the situation above, the problem is respiratory acidosis. Respiratory because the arrows go in opposite directions, and acidosis because the pH is less than 7.35. Causes of simple acid, base imbalances, respiratory acidosis, respiratory insufficiency, respiratory arrest, airway obstruction, COPD, respiratory alkalosis, SAO, hyperventilation from pain, anxiety, thyrotoxicosis, metabolic acidosis, renal failure, diabetic ketoacidosis, diarrhea, metabolic alkalosis, vomiting, excess bicarbonate, too much antacid with sodium bicarbonate, gastric sectioning. Follow my page for more tips.